Good morning, everybody. Much better, thank you. Must be all that high energy you got here in Lynchburg. Okay, great, glad to hear you. All right, so we got people online also, and I want to let you all know that this is an MS Views and News Compass MS Care program. Today's program was sponsored by EMD Serono, Genentech, Novartis, Sanofi, and TG Therapeutics. And then additionally, we had additional exhibitors. We had Alexion and Biogen and ANI, and I want to thank them all for being here and helping us to be able to do our programs. How about thanking them? We have Tina Allis. Tina Allis is a speech-language pathologist. She's going to be speaking about swallowing and voice issues in multiple sclerosis. Tina, come on up.
Good morning, everyone. Hope everyone is doing well this morning. So I've been a speech pathologist since 1994, and I was diagnosed in 2010 with MS. So I would like to speak this morning on dysphagia, which is just a fancy big name for swallowing issues in MS. I've experienced this personally as well as professionally, treating people with MS for many years. I served in the medical field from 2005 to 2024. And then I unfortunately had to switch back to working in the schools from the medical field because it just got to be too rigorous and too taxing. And I wasn't willing to keep the pace with people that were 20 years my junior. Although if I had really tried and didn't have to live my life, I probably could have pulled it off. All right, so let's get talking about dysphagia. So we're going to go through some things. The first thing we're going to talk about is the anatomy and physiology. And I went through this area because if you don't understand the structures and how things work, me as a speech pathologist particularly, have an hard time trying to figure out what aspect of your swallowing is deficient and how to correct it. So we're going to talk about the brain, your other structures involved, your cranial nerves, and the phases of swallowing. Cranial nerves are super important because those are the things that control your muscles involved with your swallowing. All right, so here's a fancy picture of what your brain looks like on the inside. Let's see if I can get this to work. All right. So this is maybe the olfactory bulb. Because it cut it off, I don't really remember. My MS brain is kicking in as to what that little thing is there. But you have your frontal lobe, your parietal lobe, your temporal lobe, and your occipital lobe. And this down here is, I believe, either your cerebellum, which also your brainstem. And we're going to talk about all 5 of those. All right, so other structures involved with your swallowing are not only your brain, but your mouth, your teeth, your lips, your tongue, your pharynx, which is your throat, your larynx, which is your voice box, your nerves, and your muscles. All right, so we're going to go back and talk about the lobes of your brain. So your frontal lobe, which is the one in the very front of your brain. So your frontal lobe is right about in here. It controls your emotions. It has your motor cortex, which is responsible for a lot of your motor movements. And it also controls your executive functionings, like your cognition, your memory, problem solving, and higher level things. Your temporal lobe, which is right about here. It's right down here behind your frontal lobe. So the temporal lobe has your speech center, your language center, and your memory. So a lot of times when we look at your temporal lobe, when you have had some sort of neurological event or a disease like MS, a lot of your things are controlled in that temporal lobe. Your parietal lobe, which is back here, controls your spatial awareness and your sensory processing. So I'm finding that more and more the sensory processing can be an issue in MS. That's a whole separate topic. And we just had, as part of our MS Alliance meeting on Monday, we just had a really nice presentation on sensory processing issues in MS. Spatial awareness is just more of a kinesthetic thing, kind of knowing where your body parts are in space. Again, sometimes that can be an issue as well when we talk about balance. Your occipital lobe is your vision, and that's back here. And then your cerebellum is down here, and that has your vital functions, your balance, and your equilibrium. By vital functions, I mean respiratory, heart rate, and those things. Let's see what comes next. Oh, our 12 cranial nerves and their function. So when I was in school back in the late 90s and early 2000s, there was actually an acronym that it was a little song that we developed to remember those 12 cranial nerves because we were tested on them, one. And two, it was part of my national boards when I was getting licensed to be a speech language pathologist. We're just going to go through them. Some of them are considered sensory nerves and some of them are considered motor nerves. Don't really remember which ones are which. It's been kind of a long time since I've gone through some of these, but I am able to tell you that which ones of these are involved with your swallowing. So the first one is the olfactory, which is your smell. The optic, obviously, is your eyesight. The ocular motor moves your eyes and controls the dilation of your pupils. The trochlear also is involved with the movements of your eyes. The trigeminal nerve is the one in the side of your face, and that controls the sensation as well as the movement of the muscles in your face. So this one here is super important when we look at people who have either had a stroke or who have neurological issues. Sometimes those muscles don't like to work properly, but there's treatment for that. The abductions, again, is involved with your eye movement. Your facial nerve controls your salivary glands. Super important as part of the swallowing process. Your vestibulocochlear is your hearing and your balance. So when you have issues with this cranial nerve, it can affect your balance because of the way your ear works. The glossopharyngeal is your tongue nerve, and it is involved with your taste and your swallowing specifically. So when this one is affected, the taste is not as prominent as it would be otherwise, and it also impacts your swallowing. Your vagus nerve is your heart rate and digestion, and we know in MS that when that gets triggered, a lot of bad things happen. I'm sure probably most of us in here have had some sort of a vagal response to some external stimuli. And what I mean by that is I know mine sometimes gets activated when I get overheated and I get super dizzy and lightheaded. And if I don't get somewhere cool or have some sort of a cool drink to help my body cool down, I pass out. Your accessory nerve moves your head and your hypoglossal nerve moves your tongue. So this one and this one here are all involved with your tongue muscle. I know that's a lot of information, and no, I don't expect you to remember it all. Okay, so now we're going to talk about the phases of swallowing. There are three: the oral phase, the pharyngeal phase, and the esophageal phase. I pulled up this diagram because I think it gives a good representation of your physical structures of what it looks like on a modified X-ray. So a lot of times when we have swallowing issues, your doctor will order like a functional X-ray, for lack of a better term, to actually look at your swallowing function on X-ray. It's a live X-ray. They don't often like to do those for not a regular reason. If you are having trouble, they will often prescribe this. Your oral phase starts here when you enter some sort of food or liquid into your mouth, and it goes to right about here. And then your pharyngeal phase kicks in and goes to down here. So your pharyngeal phase is probably the longest phase of your swallowing, and it's where we have the most trouble typically. And then obviously your esophageal starts here at the bottom of your throat and goes down into where it empties into your stomach. Okay, so the phases function. So like I talked about, your oral phase starts at your lips and goes to the back of your throat, which also controls the amount and the speed of your swallowing when you put in that food or liquid. So if you're having trouble chewing or moving the what we call the bolus from the front of your mouth to the top of your throat in order to initiate that swallowing reflex, to help push it down your throat, there are many different things that can be deficient in that area. Your pharyngeal phase starts at where your tonsils are or used to be, if you're like me and have had them removed, to the top of your esophagus, which starts up right about here. And that also controls that bolus down the back of your throat. Your swallowing does work on a system of pulleys and levers. So once you initiate that swallowing reflex, the upper esophageal sphincter starts to open and prepare for that bolus to move through your esophagus. And then once it gets through that, the peristalsis, or the squeezing action that goes down your food tube, you also have a lower esophageal sphincter that empties into your belly. If that system of pulleys and levers does not work correctly on the cycle that your body automatically has determined that it needs to happen, that's where you see some of the issues and difficulties that we all have experienced at one time or another. And the esophageal just goes from the top of the esophagus to down in the stomach. And like I said, it uses peristalsis to move it through. And again, in this esophageal area, there are some things that can happen. It's typically medically managed depending on what's wrong with the esophagus. But there are things that speech therapy can help with. Okay, so now we're going to talk about what goes wrong. So some of the signs and symptoms that we can see are coughing, throat clearing, sometimes regurgitation or throwing up. If it gets to be too much of a safety issue where your body thinks you're going to aspirate, it will produce the vomiting and the regurgitation of food reflex. Sometimes you can have a feeling that something is stuck in your throat, either on one side or the other, or in the middle. Again, we'll talk about that. Prolonged chewing. If you feel like you just have to chew and chew and chew and chew and chew, and the amount of food that you have in your mouth just seems to be getting bigger and bigger and bigger, and you're not able to swallow it, that's a difficulty that we can address and fix with some speech therapy. Drooling. Sometimes that's a precursor to having a swallowing issue. And sometimes it's more indicative of that facial nerve that doesn't want to work to hold up your muscles in one side of your face, or sometimes both. And then obviously if you're drooling and it's leaking out the front of your mouth, it's not helping with that bolus in your mouth to moisten it to get it ready to swallow. Leakage from your mouth, or what we call anterior spillage. Sometimes if you're chewing and trying to eat and the sides of your mouth are not being cooperative, sometimes you can lose food or drink out the front of your mouth. Muscle weakness, that's a big one. It goes back to those cranial nerves. If they're not firing properly, your muscles are not going to be able to be supported, and they're not going to work at their optimal function. These are just some of the signs and symptoms. There are other ones out there, but these are the most common that I see and the most common complaints that patients have, specifically patients with MS. You may have one, you may have multiple, you may have every single one. It just depends on what part of your swallowing function is deficient. Some treatment options. There are lots of oral pharyngeal exercises for your mouth, your throat. Again, the esophageal dysphagia, there are some things, if we address the top two phases, that the bottom phase will kind of come back alive and work. But again, it also can be medically managed in conjunction with speech therapy. Vital stim. Let's talk a little bit about vital stim. It's also called neuromuscular electrical stimulation. No, it doesn't hurt. I've been certified in vital stim since 2007. For a lot of my patients that I've seen that I've done vital stim with, that has been a life-saving godsend because it seems to be that it's the only thing that works. And I like to pair my vital stim in conjunction with either the exercises or with some sort of trials of food and liquid. I tend to use more liquid with the vital stim than I do the food, just because it's easier to access with the liquid than it is to have prepared food ready. So with the vital stim, what we do is we place 2 little electrodes on the front of your throat in various different positions to activate those nerves and those muscles. And in order for it to work at its optimal, we have to activate those nerves and those muscles. We need active contraction of your muscles so that the machine, the vital stim, and the electricity that's being produced through your nerves will work at its optimal. The other thing we can do are what we call diet modifications, either with your solids or your liquids. There are different levels of diet modifications that we can do, anywhere from thickening your liquids to mashing up your food. I believe there are 3 or 4 different liquid consistencies that we can change it to. And as far as your solids or your food, I believe there's 3. Below just regular food as to what you guys are all going to eat today. Hopefully, nobody will show me exactly what I'm talking about. So now let's touch base a little bit on voice disorders. And why I paired these 2 together is because your voice and your swallowing are controlled by the same set of nerves and the same set of muscles. You have 13 muscles involved with your swallowing, ranging from the muscles in your voice box all the way up to your tongue. The tongue being the biggest muscle of the whole system. So some of the types of voices you can hear are a hoarse voice, which a lot of people have experienced when they get laryngitis. When your vocal cords swell, it gives you that hoarse and harsh voice. You can also have a breathy voice. So it sounds kind of like this, like you're whispering. And it's very eerie sounding. And then, of course, you just have your regular typical voice. I don't like using the word normal because what is normal? Nobody knows, I don't think, what normal is. And normal is different for every individual. So I prefer to use the word typical, which is your everyday, regular sounding voice to you as the patient. Because what I judge as your typical voice may be different than what you hear inside your head. Because when we talk, our voice resonates through not only our nose, but through the whole skull system and your ears. So what you are hearing is clearly different from what I am hearing. And then the types of disorders, we have dysphonia, which is just a disorder of voice, which are the 4 types of disorders of voices on the left. Aphonia is when your voice goes completely out. It goes 100% silent. You have absolutely no voice, which again, I've experienced, but again, I was sick and my vocal cords were swollen. This one here. So my voice was not able to work because I wasn't able to get what we call approximation of those vocal cords to come together to vibrate to make a voice. And then obviously laryngitis. We've all experienced that at one point or another. And that's just for various reasons. When your vocal cords swell slightly, they are not able to come together in a waveform to make a good voice. So if you guys want a really good example of a hoarse voice, the last time I presented for MS Views and News in 2023, it's up on the YouTube channel. You can go and visit that, and it's a very good example of being hoarse, because at that time I had aspiration pneumonia and didn't know it. All right, that is the end. How did I do, Stuart? Did I keep time?
You did great.
Perfect.
A round of applause. Thank you.
Can I just make a quick comment before we take questions? So I also wanted to tell you guys, I'm also the owner of Speechless No More, which is a private outpatient speech therapy clinic. And I did bring some business cards. So if anybody wanted to ask questions or see me privately, I'm able to speak with you at that time after this presentation is over.
Person does not live in the state of Virginia and wants to know where they could find a good speech pathologist in where they live. Is there a source to go to online that you know about where there's a listing of different different SLPs in different regions of the country?
Yes. So they can go on ASHA.org, which is our national professional organization, and they can search for by state outpatient speech therapy, or they can just do a general web search for speech pathologist or speech therapy in whatever city and state they live in. And if you would like, Stuart, I might be able to help facilitate that as well if you want to give out my contact information.
Hi, I have a question about taste. I haven't been able to taste or smell in probably 10 years.
Okay.
And when I went to ear, nose, and throat doctor, and that wasn't helpful. So I'm just curious, could that possibly be a symptom of the MS, or do I need to reach out to someone else to kind of look into that a little further?
So to me, that tells me one of your cranial nerves is not firing properly. And actually, it's more than one. I was going to try and go back and see if I could find that slide. There we go. So where is it? Oh, your glossopharyngeal, your taste and your swallowing. That cranial nerve right there is probably not firing properly. If I had to guess, obviously I'm not a doctor. I can't diagnose that part. But knowing what I know about swallowing, there may be also underlying other things with your swallowing that you're just not aware of at the moment. The two may be combined together, but that's something we can talk more in depth after if you would like. Okay. You're welcome.
I've had, what is it called? The doctor will go in and stretch my esophagus. Does that help with getting choked?
Yes, ma'am. And again, that's part of that esophageal dysfunction that I am not able to fix. That definitely takes a physician to be able to manage that. But I can give you some signs and symptoms of what may be before you need to go have it done. That may give you an indication that it may be time to have it done again.
I'm curious because a couple of years ago, COVID came around and people were also having issues with taste and smell.
Sure.
Is it similar? Is it different? It's the same nerves?
So in my professional opinion, it's slightly different because with COVID, it returns. When it's a cranial nerve issue, it may not return without some sort of intervention. But again, there are probably other things involved with that because as you see, that glossopharyngeal nerve also involves with your swallowing because it controls part of your tongue. So there may be other things involved besides just your taste. So when COVID hit, from my knowledge of COVID, the way it worked the virus attacked that nerve. And again, this is just my theory. And then it made it inflame so it wouldn't work properly. That's why I feel like you lost your taste during COVID, if you had COVID, which I did get COVID, but I managed to survive, thankfully. But this one here, I think, again, that virus kind of had attacked that nerve a little bit and made it inflamed, so it wasn't working properly. And then once that virus went away, the inflammation went down and it started working again, and that's how you got the return of your taste. Again, my theory.
Hey, thank you, Tina. I do have a question, but I also have a comment. A lot of people I hear living with MS are really having problems just simply having the energy to chew. Just it discourages you to eat because of the energy. Simple things that used to be easy and now it just is hard to chew. I just would be interested in your theory on that. And then the other thing, I want to thank you for what you do, because having somebody living with MS that's in a field that helps us so much, means so much to us. Thank you for keeping going through all of your challenges also.
You're welcome. My pleasure. This is kind of, like I said, what I've done for the last 30, just had my 32nd anniversary as a speech pathologist, or 31st, I guess, if I can do math. So it's the only thing I've known my whole adult life. So this is what I do. But yes, as far as the energy to chew, chewing does take a fair amount of energy. And if you fight like I did with MS fatigue, then, and even just your everyday daily, I would say find the part of your day where you have the most energy and put your most taxing meal at that time. And then, so if that's like in the morning, have a big breakfast. Eat foods that are more challenging or take more time to chew, like bacon, sausage, the crunchy stuff like a bowl of cereal. And then as your fatigue kicks in and your energy reduces throughout the day, use a lighter, softer meal. And those are some things that I can go through on an individual basis as to which foods to kind of generate an easier set of chewing.
Anybody else? Let's thank Tina for being here. All right. Thank you, everybody, for coming. Have a great day.